Today we are going to discuss about the spleen. So in a organ, first we should know the holding of organ in anatomical position. As you see here, this is the way to hold the spleen. So you have to hold the spleen in your left hand and you have to position your hand behind the left mid-axillary line, because the spleen is located in the left hypochondrium behind the mid-axillary line. The spleen is having a posterior end and an anterior end. So these ends are also called by different names. Posterior end is also called as medial end and also called as upper pole. The anterior end is also called as lateral end and also called as lower pole. As you see here, the posterior end is blunt and somewhat rounded, whereas the anterior end is broad. Anterior end is broad. So two ends, posterior end and anterior end. The posterior end is placed somewhat closer to the midline and at a higher level. The anterior end is placed somewhat lower and far away from midline. Then it has two borders, the superior border and the inferior border. Superior border and the inferior border. So in few spleens, the superior border shows some notches representing the lobulated appearance of the spleen, and it is having two surfaces. So this is the diaphragmatic surface and this is the visceral surface. Diaphragmatic surface is related to three ribs. As you see, the three fingers. So this is the index finger, middle finger and ring finger. The index finger represents the 9th rib, the middle finger represents the 10th rib and the ring finger represents the 11th rib. It is related to 9, 10, 11 ribs. Diaphragmatic surface. So between the ribs and the spleen, there are also costodiaphragmatic recesses of the pleura of the left side and left diaphragm. So if you see the relations of the diaphragmatic surface, it is diaphragm, costodiaphragmatic recess of the pleura and 9, 10, 11 ribs. The long axis of the spleen lies along the 10th rib. So this is the visceral surface where you can see certain impressions. This is the gastric impression. This is the hilum. So above the hilum is the gastric impression. Below the hilum is the renal impression. Just close to the anterior end will be the colic impression. So between the hilum and colic impression will be the pancreatic impression. I'll repeat again the relationship of the visceral surface. You can see above the hilum gastric impression, below the hilum renal impression, at the anterior end colic impression, between hilum and anterior end is the pancreatic impression. See, this is the hilum of the kidney. You can see this is the splenic artery, which is a branch from celiac trunk. It divides into multiple branches close to the hilum, and here you can see this is the splenic vein, which drains blood into the superior mesenteric vein. Splenic vein joins with the superior mesenteric vein to form the portal vein. So to repeat again, it is located in the left hypochondrium behind the mid-axillary line. It is having a posterior end and an anterior end, otherwise called a medial end and a lateral end, otherwise called an upper pole and a lower pole. Medial end is closer to the midline, lateral end is away from the midline. It is somewhat directed downwards, forwards and laterally. It is having a superior border. Sometimes it shows notches representing the lobulated appearance of the spleen, and is also having inferior border. It is having two surfaces, diaphragmatic surface which is related to the diaphragm, costodiaphragmatic recess of the pleura, and then 9, 10, 11 ribs. The long axis lies along the 10th rib. Then it is having a visceral surface which shows the gastric impression above the hilum, renal impression below the hilum, colic impression close to the anterior end, between hilum and colic impression pancreatic impression, and this is the hilum of the kidney which is showing the splenic artery and splenic vein. And few authors also describe two angles, anterior basal angle, superior basal angle and inferior basal angle. As you see here, this anterior end where it meets the superior end. So here it is superior basal angle. Anterior end meeting the inferior border, this will be the inferior basal angle. Few books also describe it as superior basal angle as the anterior basal angle, inferior basal angle as the posterior basal angle. Ligaments of the spleen, as you see here, close to the hilum there will be two ligaments. So between the hilum of the spleen and the greater curvature of the stomach, it will be the third omentum, otherwise called as gastrosplenic ligament, which contains short gastric arteries. Then From the hilum to the anterior surface of the left kidney, lieno-renal ligament, which contains the splenic vessels and tail of the pancreas. And from left colic flexure to the diaphragm, there will be one more ligament called phrenico-colic ligament, which will be suspending the, or which will be supporting the anterior end of the spleen. That's why it is called as sustentaculum linus. 3 ligaments: gastrosplenic, lieno-renal and phrenico-colic ligaments.